Brad and I know how to share with you what we've learned along the way. For those of you who don't know me, my name's Lauren Tancredi. I am the practice development lead at Hint Health and also co-founder of Medicava, which is a practice implementation firm. And for those of you who don't know Dr. Brad, I'm going to pass over the mic to him so he can introduce himself.
Of course. Hello, everyone. I am Dr. Brad Brown. I am a DPC doc myself, sitting in my front lobby here at Strive Direct Health in the greater Denver area. Shameless self-plug. Not as cool as a location as Lauren. She's coming at us from Costa Rica. I told her I wouldn't say that, but I'm going to anyway. That is not a fake background. That is a real background right now. So that's way cooler than my waiting room. But no, I'm a DPC doc. I just crossed over the 2-year mark with my clinic. And then just so happened to also be the medical director for Hint Health as well, which is how Lauren and I know each other. So happy to be here. This is gonna be fun. This is a highly anticipated one.
This is going to be fun, and hopefully I don't lose you. This is a real background along the way. You can tell when the hair blows and the wind blows the leaves as well. But Dr. Brad, tell me a little bit about how you decided to jump into DPC and what did you actually how did you get started? What motivated you? What drove you underneath? Oh
man. So I was telling you off camera a minute ago, I love hearing myself talk. So literally just mute me if I get too long-winded. But I started drinking the DPC Kool-Aid in med school, actually. One of my rotations during the clinical years was with a DPC doc in Phoenix. I'll give him a shout out, Dr. Kirby Farnsworth at Simply Direct Health. He's probably not watching, but anyway. He was kind of a friend and mentor, and he rotated with him. And I thought this is amazing. This is the best thing ever. And so once I decided to go family medicine, then I rotated with him, and then I went to residency knowing that, hey, I wanted to start a DPC, my own clinic. I have this entrepreneurial itch too that I just can't quite scratch. And so after a few years of trying to decide on a name, which we'll get to, but that's the most fun and the most difficult part is deciding on a name and a logo. Then I decided to launch it, and it's been great ever since.
Amazing. I know a lot of the practitioners that I work with are either converting out of your traditional fee-for-service because they came in and they're just this is not how I envisioned to practice medicine, and I don't want to work this way. And then there's this huge struggle about taking the leap and potentially abandoning some of the patients that they've created and established relationships with. And so to your point earlier, it does take a certain type of energy to be able to go out there and build your dream practice where there really is not a whole lot of parameters around this is the way that you have to practice family medicine. And so congratulations, 2 years in, during a pandemic and everything else that you had going on in the world. What were some of the other mistakes or struggles that maybe you were up against and the lessons that you got to learn along the way?
That's a great question. And one that I get asked quite regularly as well by other docs thinking about starting a DPC clinic. I would say the first thing, I ordered way too much inventory. I thought I'd be just dispensing meds right and left. And I know it's I laugh and it's still sitting, it's all out of date. I should, take it to a pharmacy or something. But I thought it was just you hit, launch, whatever the launch button is, I'd hit it and people would just be flooding in the doors. It doesn't quite work like that. And I did not need nearly as much lisinopril and muscle relaxers and everything. So that was the first thing. I was okay, don't need to order all this stuff, but you know what, I have it and I need to get rid of it. Another thing would be I'm naturally just kind of a proud person, and so I took everyone's advice and then I kind of just did it myself. Everyone said, "Oh, keep your overhead as low as possible." Everyone said, "Oh, do it this way, do it that way," and I kind of just went for it right off the bat. I built a clinic from the ground up. It was a dirt floor when we signed the lease. I kind of put all my overhead front heavy, which made me have to do some side gigs a little bit more than I maybe wanted to, but I heard all the advice, but I didn't quite listen to it as much. It's all good in the end. It's not in the end, along the journey, because it's working. But I would say I probably should have listened to those friend tours a little bit more. But in the same time, we've all heard it. Once you've seen one DPC, you've seen one DPC. We kind of all do it how we see it and how we want to do it. And that's kind of how I did mine, right? But I don't know. You help a lot of practices, a lot of people in different areas. Same question to you. I'll bounce it right back to you. What have you seen?
Yeah, I think that there's this whole thing about being perfect, right? You have to have all the things ready in your clinic for the people to come and get served, right? And it's actually this is Yeah, like this is a practice. It's something that we get to be journeying in and through along the way. It's not like I have to have all my stuff done. And I feel like, and this is as a non-clinical person, like you guys get your hands smacked a lot in med school. Like you can't mess up, right? Because there's no forgiveness. Like you can't kill somebody. But in business, like this gets to be your sandbox and your playground, and you get to do things differently than you've ever done them before and make mistakes. And so I think that, and I'd love for your feedback on this, but like in my mind, it's like we've been trained our brain to like know all the things to get it done. And in business and in entrepreneurship, it's just about taking risk and failing forward fast so that you can get yourself together and be like, okay, I ordered too many meds. Now I know, let's go to the next thing or whatever it is, right? And so like, how do we get out of this like journey of being perfectionism and just get into progress along the way?
That is such a cool insight, and one that because I am one of those perfectionists, right? I would never have thought of that, but you're on a whole different level of bird's eye view of so many people like myself. That is so cool. That it is okay to fail, because in med school and residency and training and medicine in general, failure just is really hard to stomach, because oftentimes it is a bad thing for someone else, a patient or yourself. So that's good. Why didn't we chat 2 years ago, for crying out loud?
Hey, I don't know. Most people don't know we exist out there, right?
Yeah.
Or they're like you and they just want to do it themselves. And that's like the experiential learner. Like totally get it either way. But I would say the other big thing is like get support, right? So even though you're doing it yourself, you had friends and mentors and people that you could reach out to. And I think one of the most beautiful things about the community of DPC is that, there's so many people that are willing and able to help and give advice and recommendations along the way. And so if you had one thing that you wish you knew when you started, what would that be, Dr. Brad?
Ooh, one thing that I wish I knew when I started. I mean, honestly, you don't have to be perfect. You don't have to have it all laid out. I mean, that's so well put right there. That I mean, I wanted every box checked before I hit that launch button. There's not a launch button, but in my mind, it's like, you got to check everything and then you can hit go. I wish I would have just, instead of having it all there, ready, fire, aim is kind of how I heard it from an entrepreneur one time. It's like build the ship as it's flying, fold your parachute while you're falling, all that stuff. So basically just put it out there. That's the scariest part, especially for us doctors. Putting yourself out there. It's okay to make mistakes. It's okay to tweak and try little things here and there, because it's not going to be perfect right off the bat. It's not going to be perfect 90 days later. It's not going to be perfect 10 years later. There's always going to be little things tweaking. And so I wish I had known that, to where it was just like, hit the launch button sooner, get it out there, because it's a product that sells itself. Once the people understand DPC, they're like, oh my gosh, this is a win for everybody. Well, look at this. We have a question. Let's see it.
Yeah. So Michael's asking, how did you go about attracting patients, and did the rate of acquisition square with your projections, and do you focus on employers? How so?
Ooh, that's a great. I think that's probably pointed at me, right? Yeah.
I'm gonna say, I can give some feedback, but I would love to know your
Sure. Okay. Yeah, I'll go first. Again, I love hearing myself talk, so I thank you for letting me go first. So yeah, my Mr. Miller, Dr. Miller, great question. This is, I mean, there's ebbs and flows. I mean, I've been technically practicing for 2 years, but I've been in the DPC scene for a lot longer than that, and hearing what everyone else says with their practice, it ebbs and flows. The first quarter of every year is a lot slower. There's a lot higher attrition rate, a lot more churn, whereas the back half of the year is a lot more signups. Even knowing that myself, like right now we're at the end of Q1, we've had some good churn, and it kills me every time someone cancels. It's like personal, like it's not personal. But starting off, it was, I set my projections at 25 new patients a month. And I've been right at that, if not, 25 to 50% above that every month since starting. And it doesn't matter how many marketing dollars I spend or whatever. It's all the consistency. It's just the word of mouth and the consistent effort, and everything went into it. It kind of, some months, we're at like 20, and then the next month we're at 40 or something. So we're on the up and up. But it's all, I've heard anywhere from 20 to 50 new patients a month is safe, depending on your demographic. That's kind of what a lot of the smarter people than me in DPC say. So I set my projections on the lower end just to be conservative. Some people, it's all word of mouth for me now. So do I focus on employers? We see a lot of employers. Do I focus on them? Probably not, just because me personally, I wear a lot of different hats. Hint Health being one of them, my clinic being another one, full-time dad as well being another one. So employers are starting to reach out, just from other employers telling them about direct primary care in general. But I don't go out and actively do outbound stuff to them. A lot of DPC docs do and are very successful that way. I just literally don't have the time. So, Lauren, what do you think?
Totally makes sense. I think congratulations on 25 to 40 a month. That's really great. I think that from my experience, I see people like at the upper echelons in the 20s, right? But 10 patients a month for people that are kind of like doing the moonlighting thing. And then the other side of it is like, how fast do you want to grow? Because taking on 25 new patients a month, that's 5 new patients, 5 to 6 new patients a week. Like, what do you want to do? Because you came into this to build your dream. And so you don't want to go immediately into burnout. And so like, I would kind of agree with what Dr. Brad said, like be conservative in your projections, make sure you're building a life that you want and you're not over delivering. And what happens, at least in my experience, is when clinicians are starting out, they'll like spend more time with their patients and all that kind of stuff, which is not going to be sustainable. So like more than anything, like make sure you got your boundaries protected. You know how you want to utilize your time and you're teaching your patients early on how they get to be with the practice. Because if you want to grow to kind of the levels where Dr. Brad is talking about, and even attract those employer groups in, you don't want to be limited on time. That's the only thing that we have a limitation in terms of our personal resources. And so definitely want to take into consideration that. And then from an employer perspective, what I'm finding with a lot of these groups that I'm talking to, and even like the Thrive cohort that we're launching in April, is a lot of the employers come from within the practice, right? And so your patient may own a business. And so all of a sudden you get introduced to somebody and then you're networked into a group. And so like pay attention to who's coming through your doors. And one of the practices I work out of Olympia, Washington with, like they've got like 6 employees coming from an employer. So it gave us an opportunity to go to the employer and say, hey, we got like 6 of your employees here. Like, let's talk about what else we can do for you, right? And so just pay attention. And this is why it's like, you're not just a clinician, you're an entrepreneur. You got to pay attention to like what's coming in, how it's coming in, and like follow the breadcrumbs to what's successful for you next.
Absolutely. But you're the voice of reason here. I love it. We got some more questions coming in. I'm just going to close this one real quick. I went to a BNI group this morning, which I go to all the leads groups and chamber events and everything, but I've never gone to an official BNI group. And it was like a feeding frenzy. There were 2 people who knew about DPC and they were vouching for DPC in general. So whoever told them about it, thank you. But then it was just like, BNI is very structured and it was just completely off script and they were all just asking so many questions. It caught me off guard because I was not expecting to say anything over there. So yeah, following those breadcrumbs and being like, hey, I didn't think this is where I was headed, but I'm just going to explore this. I might get 1 patient. I might get 1,000 patients. You never know. Oh, it doesn't work. Okay, let's just I'm going to just keep doing my thing. So that's a great point. Good voice of reason. I'm learning so much already. We need to chat more often. But staying, you're a doctor, but you're also more than that as a DPC owner. So anyway, Dr. Arnold, fantastic. Any advice for handling HMO patients who want to join DPC? What do you think, Lauren?
Well, I missed your, I think you're answering the question. I got froze for a second there, but
I just asked the question.
Just one, it's an educational process, right? You have to understand, like, you have to teach them like, hey, I'm going to be out of network. I'm probably not going to be able to refer or prescribe or like that kind of thing. So option 1, find a local provider that you can work with that might actually be able to share in the primary care responsibilities. But a lot of times what I do with our practices that I work with is put together an insurance event in the fall, teach people how to find a catastrophic with a high deductible so that they can switch plans, right? And like, nice. And really educate and empower your consumer on how to actually spend their medical dollars. I've been in this space for over 15 years and it's changed drastically since the advent of like Obamacare. Like people actually have to think about like, how am I spending my dollars? And yet it's the most overlooked thing. We don't even, like nobody's really educating them on that process. And we have this misconception of insurance and how it's supposed to be used. You guys all know this already. And I'm not telling you anything you don't know. So I'm curious. I mean, do you get HMO patients that are inquiring into your practice, Brad? And how do you handle that?
Absolutely. And this is my first thought is very demographic specific. The demographic we're in, typically the patients who, are on an HMO or with an HMO, whatever word used to describe that, they see Strive, my clinic, as basically a convenience fee for them, right? to where they can have a quick text to their doctor. If I say, hey, this probably needs to be referred, then they go to their primary care, the in-network doc. And so that's very demographic specific to where they can afford both, and being on the HMO as well as paying my membership fees. So that's kind of how I manage them. Say, hey, I can't refer, but if you want to pay cash, then sure, pay cash. And then if you need anything that is insurance that will be covered, then we'll go to the normal in the system side of things. So good question.
Yeah, whatever that normal is, right?
Yeah, right. Questions.
All right, so great.
Okay,
yeah,
go ahead.
Great question. How do you manage your member communication? We'll start with you.
Well, this actually goes back to what you said earlier, where when you initially start, you're like, you have all this time in the world, you want to spend hours and hours with your patients, they can text you, blah, 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 all this stuff. And as we've grown, we've definitely had to reset some expectations on that. And I got great advice from another local doc here in the Denver area. And she told me, she said, don't do that. Don't spend a ton of time up front because it sets wrong expectations. And again, that was part of my hearing, but not listening. I was like, I hear you, but whatever. And now I wish I had listened to her. So, but it's still great. Nothing's wrong. But how do we manage it? We use Arrow DPC, which is now going to be the Hint All-in-One. It's all rolled into the patient chart. So patients text from their native iMessage or Android Messenger app. It bounces through the system in their chart. And it's right to our phones, and it's super simple, super slick, shameless plug for the Hint All-in-One product, of course. Some docs use Spruce, others just give out their personal cell phone, which still shocks me a little bit whenever they tell me that. But to each their own. Once you've seen one, you've seen one. So.
Yeah, and I think like you said, being able to have it all in a system where your documentation's seamless and then everybody's got visibility into everything is an amazing tool suite for them, because then your patient knows too, they're taken care of end to end, right? And so just to kind of piggyback on the member communication thing, one of the things that I've been teaching folks to do and is in part of our DPC accelerators, create a really solid onboarding process that really teaches people how to be with the practice. What are your turnaround times for text? What's considered an after hours emergency? And spell it out for them and remind them, because we are constantly teaching people how to be with us and to create value around what it is that you guys are offering, which is so much. If people can actually see it, they just have to be reminded how to be in it and use it. And so to have a platform like that, and then even Hint, people sign up, we create a redirect to a landing page. It's got a welcome message from Dr. Brad that's thanks so much for joining the practice. Be sure to make sure you're saving this phone number and you're doing these things, right? It's just really again, teaching people how to be with us and then making sure that it rolls up into a system is so essential, being able to take care of folks.
Yeah, absolutely. A couple questions down. Hey, there it is. Katie Smith popped on the screen. This is kind of along the same lines. How do we stay in touch so then people still feel the value of the membership? One of the ways that a lot of docs do it, and we do in our system, I know Spruce does it as well, to where you can schedule communications to go out. And so if I see someone for, they have a stuffy nose or something, I'll schedule a text to go out in 3 days. Hey, how are you feeling? Or 2 days, or hey, how are you feeling? So then it's that extra touch point that at the time of the visit, I can schedule so I don't have to rethink about it in a couple of days, right? I know a lot of docs use that. That's not unique to me. But also, I know Hint just rolled out the happy birthday, automated happy birthday emails and texts, things like that. I was at another thing a lot of people do is, writing handwritten thank you notes. They pick 10 patients a month and they write a handwritten thank you note, or X number of patients a month, depending on how big your panel is, obviously. So, hey, thank you, we value you, things like that. There's a whole bunch of different ways. This is a great question, Katie, about how to feel the value. And then obviously any touch point that you have live, whether that's phone, email, or in the office, make them feel loved, make them feel like they're the center. If they're the hub of their healthcare wheel, and I'm just a spoke, we're just a spoke of their healthcare team. So that's kind of my 2 cents.
Yeah, I love that. I think that a lot of people in the Thrive cohort that we're working with right now too, they're just the same thing, scheduling those follow-ups so it feels personal, right? But if they're not coming in, how do you do that? And so to your point, Dr. Brad, Hint is sending out the birthday emails, and then it depends on how big your panel is, but let's just say you have 400 patients in your panel. Once a quarter, you call on 100 people. That's 30 people a month that you're doing outreach to, or you're scheduling a text to, or something. In addition, a lot of the groups that I work with, the insurance event, they're doing some type of online town hall meeting, or I have a doctor that does a walk on the track every Thursday night, and he's got like 40 people that come out and just like walk with him. And when he's not there, there's an ambassador of the practice that's like walking with everybody else. And so he's like really working on building community, which is an amazing thing. Plus he tells everybody to walk 10,000 steps a day, right? So now he's living the practice and doing the things. And so, you know, just looks at like, what are your values? What are your health kind of like goals, and what modalities do you like to work in? And how do you educate and bring people into those things so that they can expand and be empowered beyond coming into your clinic walls?
Basically magnifying your own strengths, right? Like
absolutely.
I'm totally fine with handwritten notes, other people not so much. You know, other doctors, for a doctor standard, you can actually read my handwriting. Okay, it's not great. But that other doc who, I mean, he was going to walk anyway, so it's like, why not just invite other people? So that's great. Katie also asked a question a little bit ago. Does 20 patients a month or any number include the new children who are also included with the parent sign up? So short answer, yes. I just include any patient. So anyone who signs, if a family of 10 signs up, that's 10 new patients at my practice. So yes, that's a short answer to that question, just because I want that number as high as possible. Mr. Chef, how do you price your membership tiers? Ooh. What do you recommend, Lauren? Because this is a fantastic question, one that gets asked all the time.
You know, well, it obviously depends on the level of care that you want to provide. There's some people that are bringing extra diagnostics in, they're making longer physicals, all that kind of stuff. So there's two components that I like to look at. It's like, what are the cost of goods that is going to be included in the physical? And then how much time do I want to spend with people over a 12 months, right? Because ideally what we're doing is we're selling them a journey. We're not just selling them a one-time visit. And so I look at studies from KPI Ninja and everywhere else, right? And it's like, okay, on average, we know that patients come in about twice a year. There's 1.7 like phone visits, like, and so all of a sudden I can start to calculate the time it takes for people to be in response to these things or plan these things. And not everybody's going to use 100%. Not everybody's going to use 20%. Some people are going to use 150%, right? And so it all kind of like averages itself out. So there's a little bit of science in the way that I like to equate things, because I want to make sure that you're making enough dollars for your time. And also that you're not having to chase more patients because all of a sudden, like, you don't have enough money to pay the bill. So you want to think about like, what are the costs? What are the milestones, which I want to ask you about too? Like, what are some of the milestones that you hit along the way so that you know, like, okay, it's time to increase my pricing or expand my team or whatever it is, so that you have enough financial sustenance to make sure that your practice is operating and you're not having to like go and chase more money or think about your receivables and all of those things. And so I don't know if that was a clear answer, but cost of goods, time, definitely a thing. And then what are your expenses at the end of the day? And look at who else is like doing DPC in your region and what their price points are at, because I think it's important that you know like what the value proposition is that you have to offer and what other people are charging. But I mean, how did you come up with your pricing?
That's fantastic. I didn't go nearly that granular on all that stuff. I wish I had. Again, we should have gotten together 2 or 3 years ago. No, man, my mind is just racing right now. That is so good. But what I did was I looked at obviously all the DPCs in the area. I looked at what my value prop was. I work in the ER as well, so I kind of tell patients I'm an ER doc as well. And so, you know, you never have to go to urgent care again type of thing, you know, and so patients love that idea. But I looked at other DPCs in the general vicinity, which there are a bunch in the area, but they're geographically kind of a little bit farther away. And so I was kind of picking a dry zone, if you will. And then I looked at all the demographic info on construction documents. Don't laugh. This is way, maybe I did get granular, who knows? And saw, you know, average, you can find all this stuff, it's public record, you know, average income, average age, average family size for, you know, 1, 3, 5 miles from a specific point. I looked at all that. I knew the general areas of where, you know, more established families were versus younger families. And then hearing all the advice from some of the older DPC docs, the DPC docs who have been in practice longer than me, saying, you know, if you price too high off the start, that can hinder your growth. And so I didn't want to go too high, but I didn't want too low. So I just picked my prices after a lot of fretting, and I just closed my eyes and hit the launch button. And it's been good. So after all that research, it panned out.
Yeah. And I would say like, analysis paralysis is real. Like, don't let all the data like overwhelm you. But I also know like when I work with providers, like they like the data. That's what you guys do. You're like investigators, you're collecting stuff. So we look at all those things too. And you pull the US census, right? It hasn't been updated since 2020, but it will give you a good idea of like how much people are making in your area, what the threshold is, and how many providers are even available for primary care, right? Which I also think is another great data point for you guys to be able to share and speak to and all of that kind of stuff. And then we do the same thing. If you're converting from fee for service into a DPC practice or a membership-based practice, we look at who's in your patient panel. We look at their zip codes. We look at how much money they're bringing in. And so that we can understand, like, what is the threshold? And I would say a lot of the folks that I've been getting as consulting clients in the last 2 to 3 years are, I started too low. How do I now increase my pricing? Which is a whole nother conversation and kind of an orchestration of like, how do we do this in a way that's not going to break your practice, but also like just test the market. Like even if you're like ready to come up in pricing, like put your new pricing out to the public, see if they get it before you start to raise the pricing on your current panel. And so, yeah,
that's good. That's so good. Oh, another one from Mr. Miller, Mr. Dr. Miller. What capital equipment do you believe is essential to start? This is, you could ask this to 100 different DPC docs and get 100 different answers, right? I mean, I'm not wrong in thinking that. Again, I loaded everything. I front loaded everything in my clinic. And so obviously exam table, all the gadgets and gizmos to be a primary care doc. Some docs go and get all the weight loss essential stuff. Some of them have, laser hair removal, things like that, med spa type things. I would say you don't need, there's nothing essential to start. You can just start. And then again, like Lauren, you were saying, test the market, see what people want, and then kind of follow that breadcrumb. But you don't really need anything other than, the name, logo, website, your LLC, EIN, bank account, and malpractice, pretty much. That's pretty much the bare minimum, and you can start to pretend to fly, I guess. But
yeah, I would agree. I mean, I have a doctor that's been practicing probably for 6 years since we converted his practice, and he's got like 2 rooms and a little suite. Like it's not even at maybe 750 square feet. A massage table was his exam table when they started, like just to have something in there. And he's got a desk, and so it's like to your point, Dr. Brad, like, and everybody else who's out there watching this, like you're building your dream. What is your dream? Figure out what that looks like so that you can actually bring it to life in your practice. And I think that, surveys are back to your, like, how else do you get members, like communicate with members who aren't coming in the practice? Like send out a survey, figure out what they want, what you get to bring in. And so again, I know we keep answering questions from the audience, but I'm curious, like for you, Dr. Brad, was there any like milestones that were like, okay, when I hit this, I did this for you during your startup process?
I was reading a question. Sorry, say that again. So
if you were to think about like any milestones in your practice, like I know Dr. Bree and I jammed one time, and she's like, the one thing I did was like, I made goals for myself. So when I hit X amount of patients, then I brought in this new piece of technology, right? And so curious for you if you had anything like that uncovered itself.
Maybe I need a new iPad. I should just reward us with a new iPad or something. I don't know. No, that's a great. No, we honestly, March has slid by. I meant to do like a little celebration with myself and the other docs. So one of the questions was, is there another provider in house? There is Dr. Schuster. She's fantastic. I hired her right when we started as well, because it's a partnership, but not legally a partnership. I hired her. She just wanted to do it that way, which is totally fine. And so we've been celebrating along the way with different tiers. Like some months, it's like, hey, we got 25 this month. Let's, have a dinner with her and her husband and me and my wife, and then it's like, oh, we hit 100. Oh, we hit, 225, whatever, as we go up. So obviously that's a very objective number of how many patients you have, how many lives are you taking care of. But other things of, hey, I had Sarah mentioned this the other day. Hey, I had a really good conversation. This, basically we celebrate wins for our patients too, not with our patients, but we celebrate them because we're part of them. And so we tell them we celebrated them. It's kind of weird to say it that way out loud, but can't get into too many details because of HIPAA, but you get the point. So we definitely do little things along the way. And then we haven't done I guess we did do a pretty big celebration a couple months ago. We went out to a nice restaurant. How about that, right? And then it was a lot of fun. So yeah, just little things along the way just to keep it fresh. I haven't thought about rewarding Strive with like a new piece of technology. I could use an ultrasound machine or a little handheld ultrasound or something. That'd be fun.
Yeah, I think, and especially as you like kind of evolve your practice, right? Like years into it, like your question, like around churn and like all that kind of stuff. Like how do you keep people in? How do you bring in new health tech and like that type of, and tools and whatever it is, right? And also for those of you that are starting, it's like, what is the threshold before you hire your first employee? right? This is a budgeting thing for you. And it also will help you understand like what is the trajectory that we need to get to in order to make sure, again, that my business is viable financially, but also I'm getting the support I need. Because the other thing that I realize a lot about you guys that are in this space, like there's a lot of lone wolves out there, and there doesn't have to be. Like, this is actually a really creative, co-creative, collaborative community that you get to work in and get support from each other. And it's not competitive med school anymore. Like, this gets to be something fun that we're growing, because in numbers, obviously, we'll be able to create a bigger and better ripple out into the world. So people are like Dr. Brad at BNI, and they're like, wait, DPC, we've heard about that thing, right? And so that's when it gets really exciting.
And I'm a firm believer that you attract what you are, right? And there is no doctor like me. I'm a snowflake, but there's no doctor like Sarah Schuster either. I point here because her office is right there. She's not here today. But, there's no doctor, down the street, 5 minutes away, she's just opening and so she's come by and seen under the hood, and I love that, because I did the same thing when I was starting. And it's not, altruistic of me or anything, but it's like, hey, DPC, I firmly believe is the way of the future. And so it's my way of being part of that future. And so you're right. You're exactly right of spreading the good word, if you will. So.
Yeah, I mean, there's 7 billion people on this planet. You guys can't take care of all of them.
8 billion.
8 billion people. Look at it. Now I just got upgraded.
Yeah.
Yeah. And so, you get to share and do all the things. The last question, I'm curious, what's the max number of patients that you think you'll be taking into practice?
Yeah, again, hearing and listening, two different things to different docs, anywhere between 600 to 800 per physician or provider or clinician, whichever term you subscribe to nowadays. It seems to be where you can offer that DPC level of care, right? 600 to 800. So with myself and Sarah, sure, 1,000 to 1,600. I don't know, somewhere around there, because we can cover each other and be here or both here or not. I don't have plans to make like 50 clinics or anything, but we are opening a second location about 20 minutes away on Monday. And so we'll probably start hiring a third doc by the end of the year. And then maybe a third location, depending on how that goes. So it's like, 2-3 locations, have a bunch of docs, have a bunch of staff. I think that'd be a blast, And so I don't know if I have a hard cap. There's some docs who are like, I'm having 400 and that's it. I'm sure you've seen this, Lauren, where it's like 400, that's my lifestyle. It goes back to what you said. What's your dream? What else do you want to do? Again, I wear a lot of hats. And so having other docs with me to help cover while I'm working in the ER or doing live streams, for crying out loud,
Yeah.
And it's a collaborative approach to where I'm not a lone wolf and I can run a case by her, or, I call her probably 5 times a day. Like, hey, what do you think about this? Hey, what do you think about this? She does the same to me. So it's a lot of fun. So
that's awesome. Yeah, I think I see that too. Like, I know there's one woman in the cohort that was going through right now. She's like, 400. I want to be home for my kids' soccer games and do the things. And so, like, you get to name it, whatever it is for you. Like, that's the most exciting part about this thing. And it all rolls back into your, your goals and your financials. And so, all right.
So
here we go.
Opening in July. Vaccines, good question. This is a good one. You don't have to have vaccines. It's really hard for DPC clinics to get vaccines. VaxCare used to be awesome. They're still awesome. They just don't work with DPCs anymore. Local health departments will do shots for $10 to $20 a shot. And even the combo shots for, kids and babies. So there's 3 county health departments within 20 minutes of my location. And so I just say, hey, for all the scheduled vaccines, just go there, super cheap. Some docs also they have a local pediatrician that they just schedule a nurse visit with the pediatrician, and then they can run their insurance through there. There's a couple different ways to do it. If they want to pay cash, local health department. I have flu shots and Tdap, things like that in house. Those are cheap, but the other ones are hundreds of dollars per shot. I'm just not going to pass that on to my patients. So there's ways to get around that. But congrats on opening July. That's no small feat, Jeff. Dr. Jeff.
That's awesome. Yeah, excited that you're coming into the DPC space. And then regarding like subletting, like totally up to you. Like a lot of this is like, how much risk are you willing to take? Like how much skin in the game can you put in there, and how much budget and runway do you have? Like, and so if you're somebody who likes to be a little bit risk adverse, like subletting is not a bad thing for you. Plus you get to like tap into a local community and potentially another provider that may be able to create some kind of referral exchange or network for you in that regard.
Yeah. I would say doing what I did and just doing it all up front and construction, all that stuff, definitely a little stressful financially, but it worked out for me, but take that with a grain of salt. So subletting is probably the smarter choice. We'll just put it that way.
Hey, I like going all in. You might as well go big, right?
I'm risk averse.
Yeah.
How important is it to experience really nice, investing in beautiful welcome packages, etc.? So yeah, whatever your brand is, start with why. People don't buy what you do, they buy why you do it, right? Simon Sinek said best. So Katie, this is a good question to where whatever your brand is, be consistent and be consistent in your consistency, right? In all of your social media posts. I hate social media. I post like once a month, which doesn't do anything for the algorithm, but whatever. To where, having the same color scheme, the same font, everything, my sister is a incredible photographer in St. Louis. And so she took some really good headshots and pictures of our clinic that we've just recycled over and over. So I think investing in, good photography, maybe some good videography as well is worth it. But that's, again, maybe I'm not so risk averse. I kind of thought I wanted to build my brand, and that was part of building my brand. What do you think?
Yeah, I agree with you. I mean, one, like, do you have to invest in it? Like, there's so much you can do with free online tools and like templates and Canva, and like I use hazing and like all of everything that I recommend in terms of like onboarding and get people their welcome packet. It is all coming from online. Like, and you can literally do it. And we would take it again, the DPC accelerator at Hint would take people through like that whole process of designing all those materials so they can put them online. And it literally just cost them the time to do it. And so kind of to your point, Brad, it's like, and if you're going to invest in something, invest in your brand, like in what you want to, like who you want to be in the world. And there can always be a version 2.0. Like, don't overthink it. That's what I want to stress more than anything. Like, analysis paralysis, don't overthink it. Just get to done. And one of the things I like about the welcome package, again, is because we're teaching people how to be with the practice, and also like what to expect over the next 12 months. Like, I want them to think about long-term investment in their health. This isn't just like an as I need you thing, because many of you, and I'm sure Brad, you get this objection too. It's like, I'm healthy, I don't need this thing. And it's like, yeah, those of you that are healthy usually are the ones that are getting overlooked. So let's make sure.
Being healthy is the goal.
Yeah. Let's make sure that you have a great experience. So how important it's as important as you make it at the end of the day. And Hinge has got some great tools through lessons that we put together that can actually show you how to automate this process and create some really nice looking stuff pretty quickly. And then while we're here, I'm just going to do a shameless plug for the DPC Summit, because I know that you're doing some stuff with residents on how to start their business. I'm going to be doing the Accelerator Day, and we will teach you some of these things that you're talking about too. So both Dr. Brad and I will be there in San Diego, along with a lot of the other Hint team and some of the great people in our community to help share what we've learned along the way so that you guys can actually put this stuff into play.
Absolutely. That's great. I am excited. It's going to be a fun time in San Diego.
So I know you're doing some work with like residents and trying to help them do what you've done. I'm curious, like, what do you think like some of the basic things, like if you put together a checklist, like, hey, here's the 5 things that I absolutely needed to do when I got started?
The fun things are name, logo, and website, which Hint, part of the all-in-one everything, has a website builder. So it's super easy because that is a analysis by paralysis. No kidding. You can tweak and tweak and tweak your website as much as you want. But at the end of the day, you literally have to hit publish eventually. But super easy through the website builder. So yeah, name, logo, website builder. Get a LLC, which some people want to go through like a LegalZoom or a lawyer. Other people, I just filed it with the state. It's not that hard. $50 here in Colorado, and actually just went down to $5 or $10. They decreased the price. Not 2 years too late, but whatever. And then once you have your LLC, you get your EIN from the IRS. Lots of letters being thrown out here. And then once you have that, you can get a business bank account and credit card, and then obviously malpractice. So those are the basics. And then whatever technology you want on top of that, the tech stack is the next piece. Because to document, you can literally just write on a piece of paper, to start. But the tech stack would be, the Hint all-in-one or whatever, demoing all the other EMRs out there, to where you can, have faxing and a phone number and, all the EMR, all the charting, and then all of the e-prescribing and everything like that. Inventory management, which I thought I'd be using all the time when I ordered all my stuff, and then I haven't used it that much. So those are, I would say that's the bare minimum, right? And then on top of that, there's, you can get a physical space, you can do it more virtual. There's a question about what do you recommend for virtual and home visits? A lot of people do that. I've done a couple home visits. I'm 6'7" and I have really broad shoulders. I'm a male, deep voice. Like I'm kind of an intimidating presence, and I'm still a little timid for home visits because I feel like going into someone's space, you don't really know what you're walking into. So Sarah does not do any home visits because she's not a 6'7" white male. So I would never ask her to do a home visit because I feel like there's a component of safety there as well. So I would take that into effect. I always warn, at least have it in the back of your mind, right? But virtual, I mean, all the virtual stuff you need is built into Aero or Hint All-in-One. I know this is like turning into a plug for that. It's not, I promise. Maybe it is a little bit, but it's all right there. It's all logged. And so doing that, and then honestly, during construction, if you have the opportunity to sublet, a tiny little 10 by 10 room for a couple months, month to month, finding a local dermatologist or someone for 1 day a week just to do in-person exams or something. Some docs have done that too. So, yeah, so I just talked a lot right there. But yeah, I hope that got the point across of basically
the list.
Yeah.
The list of a startup list. And maybe these guys can put in the link too, or in the chat, but we have like a checklist in our DPC playbook, which is a lot of the stuff that we go through. So I don't know if Alex and the marketing team get you guys access to that, but it's a great way to kind of go through all of those things that Dr. Brad just talked about too. And regarding the office, like home visits and telemedicine, there are a lot of people that are starting this way. It's a great way to get your toe in the water to really understand. But again, I'll just go back to like, set the expectations with your patients that will not be a forever thing, especially if you are in the process of building your brick and mortar, because the experience is going to change for them, right? And so what they're buying today is going to shift, and we don't want to lose people along the way. But if we can continuously communicate and provide updates of like where you are in the renovation, get them excited, ask them about the color of the paint, like get them involved so that it's like it becomes more of an experience, right, for them too, and they're like excited to come in the office and not have you come to their home anymore, which I'm sure plenty of people would love you to continue to do.
Yep, absolutely. This is totally a personal thing. For what we did, I made sure that it was almost part of I used it as my marketing budget. The local window cleaner, right? He was getting his business off the ground. I was like, I don't need my windows washed, but sure, come wash them anyway. It's part of my marketing. And now he's signed up as 3 employees. That's obviously a win. Other times there's a hair salon that we share a wall with. I just swing by and say hello, just to say hi, to be a good business neighbor, things like that, just to try to keep those relationships. I see it as, instead of like paying Google and Facebook to run ads, sure, I'll pay the BNI. I'm sure I'll pay, other ways to, like, I don't need certain things, but I'll pay you for it because I know that you are going to talk about me to other people. And word of mouth is that's just what I do. Anyway, a couple of questions. We'll just wrap up these questions because they've been
awesome.
Sorry. How do we recruit additional docs to make the switch? I would say we don't really recruit, right, Lauren? I mean, I don't recruit. I preach DPC and I fill people's cups with the DPC Kool-Aid because it's a product that sells itself to physicians and patients alike. So we don't do any. I don't do any outbound. I know you don't do any outbound. You're a fantastic resource for all anyone who is anywhere in their journey. Which I'm going to ask you in a minute. How do people get on the accelerator and find you and Alex, of course? Yeah, we don't recruit at all. I mean, it's people. Docs are starting to make the switch because the consumer, the patients, are demanding. So,
yeah. I think you said it before. It's like people don't buy what you do, they buy why you do it, right? And like people buy from people they like. So it's like, how do you actually really embody your why into why you're doing this? Because that's the thing that's going to sell. This is called attraction marketing, right? So you got push and pull at play. And if you can really be a stand for what you believe in and who you are, then the right people are going to come and find you. Just to Dr. Brad's point. I mean, I've been doing like practice support and implementation for over a decade. I just launched a website 3 years ago. Like everything like you, it's like, it's all been word of mouth. Like because we're good at what we do and we help people, and it's like, then they find you and they're like, how do I become part of this bigger thing? And so how do you recruit? You just keep showing up and doing what you love every single day.
And it shows. Absolutely. It's showing right now. I want to sign up with you, but I've already switched. Cool. One other question is, what role do DPC docs play in advocacy and guidance? This is great. I tell patients and people this all the time. If I could take this wall behind me, you'll see our 2 offices, just comfortable couches in there. sitting on the couch with a patient or across from the patient and being able to have the bandwidth to navigate the system for them is like literally one of the reasons why I get up in the morning, is because people just assume that they have to pay $1,200 a month for their insurance, their insurance premium. And it's like, there's other ways to do that. Or they come in here and they don't even sit down in the waiting room. They just go, you don't have a front office person, you don't have any staff. It's like, no, this is it. So a lot of docs love that piece of it, where you can be like, hey, I can call the specialist and talk doc to doc, if I can say things right now. And we'll get the right plan in place, so there's not that loss of communication in a fax machine, for crying out loud. Why fax machines are still a thing? It's because of medicine and healthcare, but that's for another DPC Learnings live stream. So so what role do we play? I mean, people generally trust doctors, and like you said, when you like someone, then you trust them even more. And so we're a resource for these patients to have, like, hey, I had basically a non-medical thing, but what do you think about this insurance plan or health share or whatever? What do you think about Hint? So it's having that time and bandwidth to build that relationship is literally, that's why I went to med school, to be there for people that way. So
similar story. I went to nursing school for a while, and I realized really quick I was way more of a business person than I was in nursing. But really, like, why do I do this? It's because you are the ripple of creating the healing in the world, right? And so many of you, when I do the interviews of the accelerator cohort, like participants, it's like, we want people to feel heard and seen, and that is like 100% your role in being able to help provide that guidance and advocacy, and just a safe space for people to be in their process. And so that's why I love doing the business side, because it's like, through you, I get to be in my healing capacity, because I didn't finish nursing, right? But I get to help you, support you guys, one, build the practice of your dreams, but two, help the people that are coming to see you. And when the body is in pain, the people come a knocking, right? And so you guys hold a lot of wisdom to be able to help support them in their journeys.
Yeah. Well, cool. This has been a lot of fun. I think we're going to wrap it up because we are over time and people want to go. But Lauren, thank you. Last thing, how do people interested in the accelerator or hearing about your services, how do they contact you? What's the easiest way?
Amazing. So contact Hint if you want to become part of the cohort. And we've got learnings. We do all of this stuff like once a week. And then we actually have a group of people that we're helping to get to 100 patients faster than when they would do it their own. And so if you're a Hint client of any of our products, then you get access to that. And then if you're looking for support or guidance along the way, I also own Medicava, Medicava. And we are a practice implementation firm. So we take our years of experience and templates and help you move into action a little bit quicker.
Nice. Thank you, Lauren. I would say people can contact me too, but I only have a medical license in Colorado. So if you're in Colorado, feel free to reach out. Just kidding. All right, cool. Well, thank you, everybody. These have been fantastic questions. Best engagement yet to date. So sorry if we didn't get any of your other questions, but we will, I think we're going to do this monthly. Is that what it is, Lauren?
I think so. I think they said like once a month on this one and once a month on tech. So stay tuned, keep connected, and reach out if you need support. That's what we're here for.
All right.
Thanks, Dr. Brad.
Yep. We'll see you.